A lot of you have heard about anemia. It's a very, very common word used kind of in medical circles. What's less common or what's less known, when doctors talk about anemia, generally they're referring to iron deficiency. But unfortunately, this is not the only reason as to why we might see an anemia develop. And that's what I want to dive into a little bit deeper, because many of you have been told you have anemia. And some of you have been told you are iron deficient, and some of you have been told you have anemia, but they don't know why. The doctors don't understand why. Maybe it's just a number of different varieties of forms of anemia. So I'm going to throw a slide up here on the screen for you where you can check out all of the different types of nutritional anemias. So aside from iron, what are some of the other types of anemias that people might develop? So when we talk about iron deficiency, there's also copper deficiency anemia. There's protein deficiency anemia. And then there's a number of B vitamins, but B12 and folate and B5 and 6 and B2 deficiency anemias can all occur. We also have, aside from that, we have a number of other nutritional anemias, predominantly even omega-3 deficiency. Omega-3 fatty acid deficiency can also contribute to anemia. And then there's another variety of anemias that are caused as a result of antioxidant deficit, predominantly vitamin C and vitamin E deficiency anemias. So if you've ever felt super tired, right? We look at symptoms and symptom associations. Fatigue, even though you've slept adequate hours. So this is one of those hallmark symptoms of anemia. Let's say you've slept 10 hours and you wake up and you're still completely exhausted. This is a sign you might be anemic. So fatigue, and I'm not just talking about general, I'm tired today, although that can happen too. I'm talking about a person who's had adequate rest. There's no other observable or known reason why they might be tired. That fatigue is kind of relentless, okay? Shortness of breath. If you ever find yourself taking the staircase and running out of breath and you're not deconditioned, or if you find yourself just sitting there, sitting still, getting short of breath, or if you find yourself just taking a few steps and this minor exertion creates a shortness of breath, you might be anemic. Other symptoms, some common ones include brain fog. Brain fog is very, very common, and this because lack of oxygen to the brain can trigger an inability to think clearly, or a memory problem. Memory loss is part of that brain fog scenario. And then we also have muscle issues. Your muscles demand oxygen to drive energy production, and so pain in the muscles, knots, chronic knots in the muscles, spasm in the muscle, all can happen. Exercise intolerance is another common symptom linked to anemia. So if you're suffering or struggling with these types of symptoms, if this is a common kind of wheelhouse of what your day might look like, slept plenty, wake up tired, short of breath, brain fog, can't exercise because it hurts, muscle pains and spasms, you find it difficult even with minor exertion, like these are all hallmark symptoms of anemia. Now, these also match. Guess what this matches? So this is where you kind of have to. Low thyroid can also create these same exact symptoms. So sometimes what I see in my clinic is I see people come in, they've got a diagnosis of low thyroid, they've been medicated, medicine's not working for them, right? So maybe they've been on the medication a number of months, they're still struggling and suffering with this series of problems, but nobody ever checked them for anemia or any of these deficiencies. And so when we isolate, a lot of times when we isolate and identify these potential issues here, what ends up happening is it's not necessarily the low thyroid per se, it's the anemia being caused in one of these areas that's leading to these symptoms, and that's why the thyroid medication doesn't work. So even though these match thyroid symptoms, and if you have a diagnosis of a low thyroid and you still feel that way, even though you're being medicated or even though you're being treated, it might be because it's not the thyroid causing the problem, but it's the anemia creating the problem. So many of you probably struggle with a thyroid problem. That's arguably, I think it's usually it bounces back and forth in the top 5 as far as the prescription medications written in the United States. Thyroid is one of those top 5 consistently year after year. So I know it's a prevailing problem, but anemia is a prevailing problem too. And it's super, super common, although it's commonly dismissed, unless, of course, you have an iron deficiency. So let's talk a little bit about what that might look like in anemia. An iron deficiency anemia is typically going to be, on the blood work, it's going to show low iron. You might also see low ferritin. Ferritin is iron storage. It's a marker for iron storage in the liver. But you also might see some things like reduced red blood cell count. You might see a reduced hemoglobin. You might see a reduced hematocrit. These are just markers that oftentimes doctors will look for in the blood. You might see a reduction in MCV, MCH, and MCHC. So these are blood tests that are oftentimes run. It's really standard chemistry blood tests that any doctor can run. And iron deficiency oftentimes manifests with these all being low. Now, sometimes it's not just so simple as them all being low. Sometimes it's one of a few of these. So you might see an iron deficiency coupled with low red blood cell count coupled with low hematocrit. It won't be 100% matching of this scenario. And that's the trick with anemia. It's not always textbook. It doesn't always show up as textbook. So if your doctors, a lot of times what I'll see is the doctors will run the tests from here down, and this will all be normal. So like these, we'll just draw a box around this. This is part of a workup of what's called a complete blood count, or CBC. It's a very common test. And a lot of times I'll get people, they have a complete blood count done, and this is all normal, but their iron or their ferritin was never checked. And so, again, they got a misdiagnosis. They didn't get an accurate representation of what was actually going on. And so the doctors, seeing this being normal, just completely dismiss iron deficiency as part of the problem, even though iron deficiency is the most common type of anemia that presents. This is a super common problem, especially in people with a gluten sensitivity history. This is actually the most common cause. Gluten sensitivity is the most common deficiency, in people with gluten sensitivity, because gluten damages the part of the stomach and it damages a part of the intestine where we absorb iron, and it causes iron malabsorption problems. So you could be eating plenty of foods that contain iron but not getting adequate quantities because of a inflammatory damage to the small intestine leading to malabsorption. It's very, very common to see that. So if you've got a history of gluten sensitivity, or even if you don't, if you have iron deficiency anemia and your doctors keep telling you you have iron deficiency anemia and you supplement with iron and it doesn't correct the anemia and you have to get blood transfusions, like if you haven't been checked for gluten sensitivity, you should be, because gluten sensitivity and celiac disease are two of the most common reasons why unexplainable iron deficiency anemia shows up and stays persistent. So again, if you struggle with this series of symptoms, whether you have thyroid or not, and you have a history of iron deficiency anemia and you're iron supplementing and it's not correcting, you might be gluten sensitive. On the other hand, you might already know that you're gluten sensitive and struggle with these symptoms, gone gluten-free, but you're still struggling with those symptoms, all because you didn't have these things checked. So it's important, again, just to get some of the right tests done. This is not rocket science here. These are basic lab tests any doctor can measure, any doctor can order, to help you try to rule out whether an iron deficiency is part of the problem. Now, there are other forms of anemia. Actually, I left one off the board here. I think we got zinc. We didn't write zinc in. So these nutrients below iron. So iron is the most common cause, but you can also develop similar types of anemia if you're copper deficient or zinc deficient. So zinc and copper can look very similar from this perspective. From a CBC perspective, these blood tests can show up looking like this with a copper or a zinc deficiency. You can also see the same kind of looking iron or anemia on a blood test when you have a protein deficiency. Protein is necessary for heme synthesis. Heme is the name of the protein. Hemoglobin is the name. Hg, hemoglobin, is the name of the protein that your body produces, and it incorporates it into a red blood cell so that it can carry oxygen. So again, and we didn't really talk about this a minute ago, but anemia, those of you, I assume that you all know what anemia is. Anemia is basically a lack of the ability to deliver oxygen, and it can happen for two primary reasons. Now, we're talking about either number one, you have a deficiency of a nutrient that's leading to an inability to produce the protein or the structure that allows you to attach oxygen and carry it. Or number two, you have a problem in the bone marrow that's creating a reduction in your capacity to make or produce red blood cells, oftentimes referred to as aplastic anemia in some cases. And so again, those anemias all lead to one major problem, which is a reduction of oxygen. So reduced oxygen, getting it or making it to your tissues. Remember, oxygen drives most of our biochemical processes and allows us to generate the energy that we need to function, to heal, to repair, to maintain our bodies. So we don't want to become oxygen deficit. There's plenty of oxygen in the atmosphere, right? It's just a matter of, do we have a delivery system in the form of hemoglobin that is allowed to pick up that oxygen from our lungs and take it and carry it to our brain and to our other tissues. So again, anemia is when there's a breakdown in that process. So copper deficiency, zinc deficiency, protein deficiency, and iron deficiency can all show abnormal low levels of these different factors on a standard complete blood count type of test. If we really need to try to differentiate iron deficiency from the rest, we run iron, we look at ferritin. Now, copper can also be measured. There's something called ceruloplasmin. And it's a marker in the blood that can be measured. So this can help us to identify copper being low. You can also have, in a basic chemistry test, you can have your serum protein levels checked. So protein in the form of predominantly albumin is the structural protein in the bloodstream. So, I mean, low levels of protein overall, protein malnourishment can create or contribute to an anemia. And again, just a general strategy is to have your doctor check these tests to help to discern whether or not this is an issue. So these are, again, some of your primary nutritional causes of anemia. Now let's talk next about, let me make some room on the board here. Let's talk about in detail kind of where your red blood cells come from and how they're produced and kind of what happens. Because if you understand this, you'll understand the nutrition component a lot better. And that ultimately is what I want you to gather from this conversation today. So if we've got just generally speaking, a bone, and inside your long bones, because this is where your stem cells are. Your stem cells, they're called, in short, they're called erythropoietic stem cells. They're types of cells or stem cells in your bone marrow. Specifically, their job is to help generate red blood cells. So what happens is you produce these red blood cells, and when they're first born, they're relatively large, and they have a nucleus. So they have an internal nucleus with DNA, just like all of your other cells. But they go through this process of maturation. So they mature, and as they mature, they get smaller. And then as they fully mature, they take on a completely different shape. And if you took biology in school, you may remember studying that biconcave discoid shape of red blood cells. And that it's discoid like that and biconcave like that in part so that it can carry oxygen or O2. And inside, instead of having a nucleus, which these immature red blood cells have, it changes place. It takes the nucleus and basically gets rid of the nucleus in exchange for hemoglobin. So this is, again, if we're looking at this is a hemoglobin molecule. Its design is that it helps to attract and carry oxygen. It also carries carbon dioxide. So it takes carbon dioxide as a cellular waste product and helps you expel that when you breathe out, and then it grabs oxygen. As you breathe in and grab oxygen, it binds to that oxygen and helps to distribute that to your tissue. So that's, remember, red blood cells, this is a fully mature red blood cell, okay? The whole premise or purpose of these guys is they deliver oxygen. They're like the delivery truck for oxygen. And so either if you don't have enough red blood cells, or if you don't have enough functional red blood cells that look like this means you don't have the capacity to carry that oxygen as effectively and get it to the different tissues so that you can drive and produce energy. So there's another stage beyond this. If you don't have adequate iron, remember what we were talking about over here, if you're iron, copper, protein, or zinc deficient, and sometimes in the case of vitamin B6 can sometimes do this too, vitamin B6 deficiency, you can end up with a very small red blood cell that's smaller than a mature red blood cell, and this is called microcytic anemia. So sometimes doctors, they get fancy with the words, and this is one of those examples where you have your red blood cells are too small, and they'll call that microcytic, and sometimes they'll also refer to that as hypochromic, meaning that the cell itself doesn't have a lot of color. Remember that when you can carry oxygen, that's kind of what helps give it that distinct color, that distinct red color. But if your cells are too pale, they're called hypochromic. So, commonly, classically, microcytic hypochromic anemias or iron deficiency anemias. Now, if you're stuck up here, this is a different kind of anemia altogether. This anemia where you're stuck and the cell is too large, where this comes into play is you need vitamin B12, you need vitamin B6, you need folate, okay, to help with this maturation process. And so if you're deficient in these 3 B vitamins, what can end up happening is your cells never fully mature, and because they're not maturing, they're too big. And this is oftentimes referred to as macrocytic. Macro means large, just like over here, micro means small. Macrocytic, cytic means cell. Macrocytic anemia is when the cell is too large and it doesn't carry oxygen very well. When it's too small, it doesn't carry oxygen. When it's too large, it doesn't carry oxygen. Now, the pattern over here might change a little bit with this type of anemia. So B12, B6, and folate deficiency anemias, instead of that MCV being low, we might see the MCV, mean corpuscular volume, is what that stands for. So it's the volume within the cell itself. It's too high. So the cell has too much volume because the cell's too large, it hasn't matured. So if you ever have on a lab test, on a complete blood count, if you get an MCV that's elevated, this is oftentimes one of those markers that can be looked at, and it helps us to understand whether you might have a folate B6 or B12 deficiency. Again, the differences are very, very important, because if you've been told you have anemia and you just start taking iron, you might not need the iron, and actually too much iron and taking iron when you don't need it can actually hurt you because it's oxidizing. And so, but in iron deficiency or iron supplementation would not correct this type of anemia. It would just potentially create more problems for you. So the only thing you can really do if you've got a macrocytic anemia that's B vitamin deficient is you can get more B vitamins in your diet. In essence, get those B vitamins in your diet to improve the ability for those red blood cells to mature to a level where they can adequately carry oxygen for you. So we've got, again, just a little bit different of a finding here in terms of blood work is concerned. But then there are also some tests that can be run. Obviously, you've heard me, if you've listened to me for any length of time, we can run lab tests. One of my favorite is a lymphocyte proliferation test to measure vitamin and mineral deficiency. And this helps us to measure whether or not these levels are low. Now, some doctors for these 3 B vitamins will also measure something called homocysteine. Homocysteine being elevated, so an increased homocysteine can manifest as B12, B6, and folate deficiencies. And so that might be helpful. Some doctors measure instead for B12, they measure something called methylmalonic acid. Some doctors measure serum folate and serum B6, although those tests are not super duper accurate. it's best to look at lymphocyte proliferation as a tool to measure and rule out these three types of anemia, or these three types of B vitamin deficiencies that can cause macrocytic anemia. Now, we've also got other nutrients that play a role in this process. There's B5 deficiency, there's B2 deficiency. These can also be tested in the same way, but these can also cause anemias. And then we also have there's another category of anemias referred to as, so different than these ones. It's hemolytic anemia. So I'm going to blow up a red blood cell here. We're going to draw a red blood cell. That red blood cell has a membrane around it, a cellular membrane. And that cellular membrane is supposed to be strong and hardy. And so if it's not strong and hardy, it will break too easy. So what happens when a red blood cell breaks prematurely or breaks really easy? So if this cell membrane is disrupted and the cell breaks open, lyses open, this is what's referred to as a hemolytic. Hemo meaning blood, lytic meaning to cut or lyse. So hemolytic blood cutting anemia. So the cells break open too easy. And so that puts more pressure on the stem cells, on the bone marrow, on the erythropoietic stem cells to produce more red blood cells. And so what happens with a hemolytic anemia, a lot of times it's the membrane around the cell, it's just too weak, it's not strong enough, and this can happen as a result of antioxidant deficiency. But some of the nutrients that we know really can contribute to these hemolytic anemias: vitamin C deficiency, vitamin E deficiency, and also vitamin A. I just didn't write that in. Let's just put an A right here. So vitamin E, vitamin A, vitamin C deficiency can lead to hemolytic versions of anemia. There's some suspicion that omega-3 fatty acid can also cause that type of anemia as well. So again, this is not going to manifest. This type of anemia, you're not going to really have these abnormal findings here. You'll still have the same symptoms, but you won't have so much of these abnormal findings. What you might find is you might find abnormally shaped red blood cells. There's some blood tests that can be done that look at the shape, the different variant shapes of your red blood cells. And so, you know, a doctor who's looking for anemia can run those tests and those differentiators, because sometimes what happens is because your cells are breaking down too quickly and because your body is demanding that you make more, these new ones that are coming out become misshapen and malformed. In essence, when you have really, really young cells like this, they can have an abnormal shape to them. And so that can be detected. There's a name for it. It's called anisocytosis, which is just a way to look at red blood cells under the microscope and identify any abnormally misshapen ones, which can be a hallmark symptom of hemolytic anemia. So again, if that's going on with you, you might ask your doctor to dig deeper into omega-3, vitamin C, vitamin E, and vitamin A deficiencies and ask whether or not that's playing a role as part of your problem, because it's very common to see, again, antioxidant status be too low. Now, so these are your main nutritional anemias. And again, this is just a mini crash course here. Hey, don't forget to check out the rest of the series right here. Make sure you hit subscribe below. And as always, thanks for tuning in.